Today's video is about exercises for the feet. Lots of people, modern lifestyle, they have flat feet, and people are led to believe that they need orthotic support and they need surgery or they need special kinds of shoes to deal with this flat feet. A certain percentage of the population do need surgical intervention, or they do need arch support, but majority of the population don't need it because there's two kinds of flat feet. One flat foot is the kind which is flexible and the other kind which is rigid. The rigid type can't be fixed with exercise, at least as far as I know. The flexible type of flat foot is usually fixed with exercise, and so today's video is about exercises for the flat foot. See, normally the arch of the foot isn't a static structure. It isn't a static structure like you see in architecture. It's not just a rigid, it's not a constant arch. It needs to change shape according to what terrain you're on, and it needs to change shape according to what balance demands you have. So if you have a balance demand of standing on 2 feet and you're still, that's very different from if you're standing on 1 feet or you're dancing from one side to the other, or if you're running, or if you're on a rough surface, or if you're on a sandy surface or grassy surface, or on a slippery surface, or if you're carrying a weight, or if you're moving that weight around. All of these balance demands are different. So you need a foot that can adapt to those changes, and that is what you need to do when you train. So it goes without saying that you need to be training on different kinds of surfaces in a safe manner without injury. But because that's not possible, and because you need to have a structure to your training, I usually suggest several kinds of walking exercises that you need to do on a daily basis. There's 6 main kinds of walking. Then there's this. So the 6 main kinds of walking are walking from one end of the room to the other, and then you go there and you come back, and that's 1 rep. So I would ask you to do 1 rep of each style of walking in the morning and in the evening. That's my advice. And there's 6 kinds. So I'll show you the 6 kinds. So if you look at my feet, so the first kind of walking is when I walk like Charlie Chaplin there. Okay, you see that my feet are turned out as far as possible. Now you need to make sure that when you have your feet turned out like that, most of the work is being done by the hip muscles. So turning the foot like that requires your glutes to activate. It requires your hip muscles to activate, and so when you are walking like this, you will feel a strain in your hip. So that is the first style of walking. The second style is the opposite. So you turn your feet this way and you do that. Now in both cases, you need to keep your feet as close to each other as possible, and you need to make sure that you're taking small steps. Taking big steps makes it difficult and it spoils your gait pattern. So small steps, keep your feet as close as possible. Now the third type is with your feet turned outwards, so that you're putting all your weight on your outside edge of your foot. So you can see how the toes are working and how the feet is working. So this is the third style of walking. And the fourth style of walking is with the outside lifted and most of the weight on your inside of your feet, with the big toe taking the load. So you can see with each foot, you can see the other toes bending, especially the second toe bending and providing support to the big toe. So that's the fourth style. The fifth style is going to be easy for you because you are now on your toes like that. Now you can walk straight, which is what I ask you to train in the beginning, but then as you get better, you can start walking sidewards, turning. All of that adds a different kind of training effect. That's the fifth style. The sixth style is more difficult, so I would want you to walk on your heels. Now the front part of your foot is lifted. Now some of you might have pain in your heels, in which case this is the only exercise that you will do without footwear. So this is the 6th style. Now the 7th one, which I have recently added, is what I call the inchworm. It's not the so it's basically a worm. So you are going to use your foot like a worm. So you are going to crawl forward. You are going to ask your feet to toes to pull you forward, and then now this foot is in front. Now I'll start using the other foot to grip. So the toes grip and they pull the whole foot forward. So this you will not be able to do for the full length of the room because you'll get tiring. So you can do that, or you can do alternates. There. Okay. So that is the 7th style. So these are the main styles of walking that I train these days. On top of this, I ask my patients to walk backwards for 10 minutes a day. So just regular walking backwards. So you do this. So if you look at it from the side, you are going to see it like that. You are going to go backwards like that. Right. So that is your 8th style of walking. So 7 styles walking forwards and 1 style walking backwards. The 8th style is 10 minutes. You need to practice 10 minutes of reverse walking a day. If you can add some resistance to it, it's even better. So basically if you're dragging some weight behind you, it's even better. So these are the 8 kinds of walking that I ask you to do for training the feet, for training the muscles of the feet. There's more, but this is what I would like you to start with.